Hello and welcome to the Ottawa Business Journal's coverage of COVID-19 pandemic. My name is Michael Curran, the publisher of the Ottawa Business Journal. OBJ is conducting a series of video interviews with local business experts, and today we're focusing on mental health in our workplace. There's a statistic that's often cited. Each week, more than 500,000 Canadians do not go to work due to mental health related illnesses and issues. If indeed that's the case in normal times, imagine the scope of the problem in these times. Today, I'm joined by an expert on this topic who works right here in our city. Please welcome the Director of the Work and Mental Health Research Unit at the Royal Ottawa's Institute of Mental Health Research, Dr. JianLi Wang. Hello, Dr. Wang.
Hello, thank you for having me here.
I'm very happy to have you, and it's an important topic. Dr. Wang, we're all obviously very focused on the health crisis that is in front of us and the related economic crisis. What do you think we should be concerned about in terms of the mental health impacts of what we're experiencing right now?
Well, COVID-19 is unprecedented, and it's like nothing we have ever seen. So it has changed our, how we behave, how we live, and how we do business. We have seen that so many businesses are closed, and millions of people are on EI or on the new emergency response benefit. So people, when you're facing such uncertainty and such global crisis, people are scared, are concerned, and worry about that. So I think that's normal. It also reminds me a study we did back in the 2008 and 2009 when we were doing a study in Alberta to understand how the workplace factors can trigger depressive anxiety disorders. So we were recruiting our participants across the province of Alberta. We started in March 2008, and in the September 2008, the Lehman Brothers went to bankrupt, and the global financial crisis started. And when we were recruiting our participants, we observed a clear and significant upward trend of the prevalence of major depressive disorder. Okay, so yeah, and especially when you compare to the pre-financial crisis time, which is before September 2008. So now we have another global crisis. So I think it won't be any different. So I won't be surprised that the people will show the symptoms of depression, anxiety, and especially now many of us are working from home, and we were refrained from social gathering, and we have to keep physical distance. So this kind of feelings of isolation and loneliness may exacerbate those kind of symptoms. So what we need to do is to be careful, not to let these symptoms to progress into something more severe. Right? To address these physical and mental health challenges in the population, we really need to take the public health approach with a coordinated efforts. And we have seen, in the past month, we have seen all levels of governments and the public health agencies and even the private sectors, they're working together to find the solutions. I think that's public health is in action.
That's good to know. So let's dig into this a little bit deeper, Dr. Wang. If there is a business owner or a business manager that is in charge of a team of employees, what should they be looking for in terms of signs of mental stress or mental health issue? What sort of signals should they be looking for?
Okay, the COVID-19 crisis not only changed how we do business, also changed the way we how to manage and how the way to providing support. Right? So I think when in the current time, as a business leaders or business owner, communication is key. Regular communication with your team members, with your staff, even they are working from home. So that's what I'm doing. So we keep the regular communications through emails, through video conferencing. And so you can see, you may observe some changes, right? And if you keep the communication channel open, and some of them may talk to you about their concerns, right? So I think keep the communication is the key. The other thing, business owner or managers may should pay attention is the changes in job performance and productivity, right? And this may be reflected by, say, missing the deadlines or making more mistakes in the job. But you need to communicate with them and to determine why that happens, because some of the times it may be due to some unforeseeable reasons, such as you have to like a homeschooling your kids, or you have to look after your family members who are sick. So you have to communicate with them to find out what happened and how you can provide some practical help.
Okay. And it occurs to me, Dr. Wang, that there are so many video meetings going on like we're doing right now. Often the video meetings I'm involved in include large groups of people, but that's probably not the appropriate setting, of course, to dig in. So when you say communication, I guess you're recommending one-on-one communication, either in a video call or a phone call.
Exactly.
And I guess a video call does have that more personal connection because we can see or pick up on people's body language and to help determine if there's some sort of issue. But I take your point that they're dealing with a lot these days. It could be child in the home, homeschooling, could be a sick person in the home. So we don't want to make assumptions on whether it's a mental health issue. We need to ask questions. So if you were to ask a question, maybe you could help us with this in a little bit more of a practical sense. What type of questions might you ask someone if you wanted to check on their mental health?
Well, basically, it's to ask someone about their changes in their feelings, right? And whether or not they're still enjoy the things that they used to enjoy, whether or not there's any changes in their sleeping patterns and or their eating patterns, and also the way or the extent to which they can concentrate on the job they're supposed to do, and whether or not they can make a kind of appropriate decision. So these kind of depressive symptoms, those are the questions you may ask. But these, I think, to make a diagnosis here, I think the managers should decide whether or not you should probe details about these symptoms, because you should leave the diagnosis to the health professional.
And that's a good segue to the next question. So if I were to probe an employee and detect that there was some evidence potentially of an ongoing mental health issue or illness, what steps should an employer take at that point? Should they encourage them to seek professional advice? What type of resources or action should a business owner take?
Well, they can take several there are several things that they may do. First is, as I just mentioned, communication is key. Keep the regular communication. And the second one is earlier is better. So intervene earlier and to solve the problem, when it's small, before it becomes something more severe, right? So earlier is better. And number three is to provide a supportive communication. Listen to their story and be empathetic and no judgment. So listen to their story. And then number four is to provide some practical help, either say modify their job responsibilities if necessary, or offers them some point the employees to some appropriate resources. Like I say, if the EAP is a part of your benefit package, and to find out whether or not the EFAP are providing online consultation. So that's maybe the resources you can point them to, and also point them to some of the online resources like at the CAMH, the Center for Addiction and Mental Health, or the CDC website about the information about your depressive anxiety symptoms and how you can cope with these symptoms. And there are also some online resources like the CBT, cognitive behavioral therapy programs, and which is a very useful program to help you to regulate your thoughts patterns and to change your negative thoughts, and then to reduce your the depressive or anxiety symptoms. So providing this kind of practical help, and if the supervisors are working with the employees or your team members in the actual workplace, and maybe give them some breaks, and to provide a place for them to decompress, and even sometimes the spiritual help maybe is available, like say in the local hospital or churches, which can to help them. Providing some such a practical helps. And then number 4 is always keep the door of communication open. It's not just a one-time deal, and let your team members know that you are always there. The communication door is always open. Say, can we touch base again next week to see how things are going? To keep the door open, keep communication open.
That's great advice, and a great reminder, as you indicated there, that many companies will have a benefits program that includes employee assistance programs. So some of these resources might be just a phone call or an email away. We're going to wrap up with this last question, Dr. Wang. So we focused a lot on how employers should be looking out for their employees. I imagine business owners themselves or business managers who might be dealing with temporary layoffs, who might be seeing their businesses suddenly shut down, who might be seeing their cash flow depleted. They must be experiencing a significant amount of stress as well. So, what should these leaders, I guess, be looking out for in themselves in terms of mental health?
I totally agree with you. And business leaders are no different from other like employees. They're also individual persons, so they're also vulnerable to this stress because they also take more responsibilities. So I think they also need to do what the other employees as individual employees to do, like say. Have a good sleep and maybe exercise at home, and have a balanced diet. So you can find this type of information at the CDC website, at the CAMH website. And also remember to keep, communicate with your families or friends through phone or social media. Physical distancing doesn't mean psychological distancing, right?
Such a good point.
Also, number 2 is don't use alcohol and drugs to cope with your stress. And number 3 is I think the business leaders may work with their colleagues and with the local chamber of commerce and with the government to find out the solutions that may work for you. And so if you can find some such of solutions to help you to survive this type of crisis, that will be beneficial to your mental health.
Of course, that's a great point. Again, you can alleviate some of that stress by focusing on finding solutions, right?
Yes. Yeah.
Listen, that's all the time we have, Dr. Wang. Thank you so much for being with us today and shining a spotlight on this important issue. I'm sure you're busy with lots of issues. Thanks once again.
Well, thank you very much for having me here.
And I just wanted to give a shout out to the Royal Ottawa Hospital that does such important work like yours in our community. There's also, it was pointed out to me, a webinar going on tomorrow That is Thursday. If you visit the Royal website at theroyal.ca and goes to the news section, you'll see a link to that webinar. So thank you, Dr. Wang. Please stay tuned for more coverage from obj.ca on COVID-19. And you can check this out at obj.ca, our website, and also on our YouTube channel. See you again.